Hey everybody. Tonight I wanted to talk about something that's a little bit of a scam here. For those of you who are on Medicare, this is a heads up. If you're not on Medicare, this is still some valuable information from someone who has experience. Yes, I'm on Medicare because I'm disabled, so I've been on Medicare since I was 20. Now, one of the things that's being pitched to people on Medicare is a Medicare Advantage Plan. There's all kinds of private HMOs out there that will take your money, your Medicare premium, and use it to give you a private plan. It's an HMO. It's private. It's not public. On top of that, they also will go ahead and add to that. So you end up paying $300 a month instead of your $174 a month. If you keep the $174 a month, do you think you're getting good care under an HMO? No. The gimmick is they say they cover all kinds of things that Medicare doesn't. I'm finding, to my amazement and pleasure, it's been great. Medicare actually covers quite a bit, especially if you have a pre-existing condition and you need routine exams. The gimmick is, oh, they don't cover that. Yes, they do. I have to get my thyroid checked. I have to get my heart checked. You'd be surprised how much they cover because I have a condition that requires monitoring those things, right? Right. The government doesn't deny things that are considered medically necessary from a physician. And yes, that does include labs. If you need a urinalysis, ladies, yes, you can have your annual pelvic. Absolutely, it is covered. I'm amazed at how much is covered. And the problem with these Advantage plans and it being a private HMO is that there's copays that may not necessarily exist with your Medicare, and they're often higher. So not only are you paying more than your Medicare, but more out of pocket. Yikes. Another thing is they get to decide who you can and cannot see. They also have to have prior authorizations. Medicare doesn't. So with straight up Medicare, you can see anyone you want, and you get to see them quite a bit faster. And here's the best part of all. They always pay your provider, even though they don't pay very much compared to a private HMO. Private HMOs or your Advantage plans will do anything to get out of paying for it. So frequently, your doctors are left not being paid after 6 months versus Medicare, which offers a decent price and they're always paid. Don't you want your doctor paid? It's a reasonable price, and there can be sliding fee case. In case you can afford a little bit more, go ahead and pay a little bit more. But everybody accepts Medicare. You don't have to worry about paying for an ambulance because I'll get into that scam later. Yes, they're contracted with Medicare. You don't have to worry about it. It's hassle free. They got your back. Don't let go of your public insurance that you already paid for and give it to an HMO, right? To complicate things, raise prices, set limits on you, and do all kinds of hassle things. And the paperwork and denials and denials and denials that your doctor, all that time and that hassle that a private HMO Advantage plan puts you through is terrible. One of the gimmicks going around is this whole thing of senior citizens can qualify for a $2,000 free food card. Well, that's only if you sign up with an Advantage plan. So it's a gimmick. And let's face it, you're paying them $2,000 a year. All they're doing is returning your money, a little bit of it, for just a one-time shopping trip. It's not a deal, right? So do keep your straight up Medicare because a lot of people are leaving their Advantage plans, finding out that there's no advantage at all, or the advantages offered really aren't as great as they expected. and more things are beginning to be covered by Medicare that weren't before because they simply have said, hey, these HMOs are kind of scoundrels. They still give you a choice, but you would really be surprised how much Medicare does cover and that their prices are reasonable. And let's face it, everybody wants to know that their doctor is being paid and it's hassle free. I actually had a doctor and I asked her, why do you take Medicare and Medicaid if they pay hardly anything? And she said, because I don't like to deny my patients care. I want to be able to give my patients the care that they need. And HMOs don't like to do that. With public health insurance, I can get it done, I get it quick, and I always get paid. And I said, what do you mean? I thought private insurers always pay. And she said, no, in fact, they almost never pay. And so I actually make more taking Medicare and Medicaid patients because at least I'm getting paid. And at least I don't have to worry about my client not being able to afford that test because turns out the copay is huge. Yeah. So there's a little tidbit. A lot of doctors are really getting fed up with these HMOs. And so they actually like public health insurance because it's pretty hassle free for both you and your physicians. Can't beat that. So don't get duped by these Advantage plans. So many people are switching back to regular Medicaid, Medicare, discovering that these both, if you're able to get both, are unbeatable. So, just a little bit of education on why you really probably don't want an Advantage plan, because I'm finding there's no advantage at all. Take care, guys. And yeah, don't get scammed.